Rural areas have a lot of challenges because we have less resources. A lot of times the APN role becomes very important because they're a key player as far as providing leadership. So what they do is our systems thinkers are able to kind of work the system as far as figuring out where holes or gaps might be needed as far as services. They provide a lot of clinical skills and expertise. They provide mentorship for the staff. And they actually may be just one of the key resources as far as expertise in rural areas. One of the things that's really important, though, also to recognize is that there are a lot of barriers. And so what are some of those things that we can do to address those? Some of them are out of our control as far as state regulations, as far as legislation. Having too many things on our plate, because I call it solving world peace, that there's just a lot of unmet needs and not enough resources to meet those. So what do we do with that? Well, we look outside. Often our systems partner with bigger system, network at organizations, and become involved as far as accessing other resources to look at supporting yourself as a professional, keeping yourself up to date, looking at ways to partner with other resources in your community. One of the things that if you're starting a new program that's really important is building on your strengths, your relationships in the community, looking at primary care practices. I started a palliative care practice. What I did was really build on some of those relationships I already had, looked outside of myself, used other organizations, looked at cyberspace as far as patient support issues, different ways I could access support, not just within my community, but also in the national realm as well. There are a lot of resources that we learned about in doing this talk as well. So one of the interesting areas that are developing in rural healthcare is looking at telehealth. So telehealth is when we look at partnering with specialists that maybe not be available in our area, contracting with them to be able to break down the barriers of access and geography. It helps increase staffing availability, particularly in the oncology world, as far as breaking down some of those barriers. It helps save travel time. Patients actually, you wouldn't expect that they would have a high satisfaction rate, but they do. We found up to 95%. One of the things that we find about telehealth is that it increases the contact time between staff and patients that they didn't have before. Wrapping up, one of the things I would just say is that it's important for people who are in bigger settings to really partner with their rural healthcare partners, knowing that there are resources where are closer to home, helping them develop as far as increasing their quality of care and making it easier for patients to access what they need.